Okay. All right. So now let's move on to the residency match and some family medicine specific questions and advice from you. So what drew you to family medicine besides the fact that it's has a good lifestyle that comes with it? Is there anything specific about family medicine that really interests you as opposed to, internal medicine or the other specialties?
At first, I thought that I like cardiology, so I would think of IM. I also think of neurology before, but after follow up with the neurology elective, like, oh, I don't know about that. And then just later on, it's changed. You like, I really love like going to the spa and going to the massage, and finally I
Mhm.
talked to my friends about it, and I just like the fact that uh, opening up the medical spa. And when I see into that, I'm like, huh, actually, this is one of the things that I enjoy doing it. And also like weight loss program that has been going on with the pills. And I think I'm interested in that too. And also like Botox injections and stuff like that. So I feel like for those, I can open and without have to worry about like answering your message inbox from patients. And
Mhm.
that's one of the things that family medicine people hate because like those you work nonstop, you bring work to home because not just like you stop at 5 p.m., but you also have to answer a lot of inboxes from the patients and you have to chart um, things like that. But I found like as long as you know how to charge it quick enough using your AI, create stuff like that for you. And in the
Mhm.
hospital, they have some phrase for you just to do it quickly. As long as you use those tools, then you can. I think you will sufficient in that, and then you will love family medicine more compared to to the other specialty. That's what I thought. But anyway, so my point is choose family medicine because I want to do um, what I want to do after that. So
Mhm.
at first I like internal medicine, cardiology, neurology, and then family medicine. Now I've changed to spa, medical spa.
Yeah.
Um, and that's the reason why family medicine also have some fellowship as well. If you're interested after that, like sport, they can also do the hospitalist, internal medicine. They can also do that. They have a track for you to do that if you're interested. And then they also have some like other options later on, geriatric, religious, things like that. Um, that's when
Okay.
you pick to see if you like family medicine or
Mhm.
not. And I pick because I like the medical spa after
Yeah.
all.
Yeah, that's very true because I think even when I was like thinking about different specialties, I was thinking about the different applications for that specialty. It's not just like inpatient. It's not just outpatient.
Mm-hmm.
There's so much variety that when you want to look into it, you have to really ask yourself, what kind of a life do I is like my ideal life and which specialty lets me to live that, right? So your idea about having like your own clinic where you offer services such as the spa, I heard that many times. So I think that's a core component of it and Botox, et cetera, et cetera. That's very important, I think, for me as well. Like I was thinking about anesthesiology, so I was thinking, okay, when I'm like 50, 60, I still want to work, but I don't want to be inpatient. Is there an application for outpatient? So
Mm-hmm.
those scenarios are good to run through your head um, when you're choosing a specialty. So I know that, family medicine is not the most competitive specialty, but at the same time, you still have to design your application in a way to show that you're passionate about this field and that you want to pursue it. So what ways did you try to, what key experiences really helped make you stand out when you were applying for family medicine? What would you say were
Yeah,
the key components of your application?
yeah. Family medicine for sure that you have to show them that you have compassion to it. They will know that family will be a backup plan from if you don't get into IM or other specialty, family will be a backup plan. Yeah,
Hmm.
if you have that plan, I would say don't show them that. You just have to show like you have compassion in community. You have to have some leadership in there too. And then the thing is, if you don't like family medicine, it's really hard to get into it because it's very broad. In family medicine, you have to learn everything from pediatric, inpatient pediatric, NICU, all the way to OBGYN, stuff like that, very broad. And
Hmm.
you have to love them all as a whole. You like to take care from the beginning of the babies all the way to adulthood and OB. Um, Also, show them those that you interest in those community work, continuous care, like you want them to be like, oh, see the patient as a whole, not just only one part of the body, which is specialist
Hmm.
that they're doing.
Yeah.
Just show them that they you have passion into those family medicine and the work-life balance that you love, and also one of the location, like they want to keep you after residency. You have to have the family tied in the area, stuff like that. Make
Correct.
you stand out. And then you don't have to have like if you do for an academy, then you need to research. But if you don't, you just want a community. Yeah, you don't have to have those. Um, and stepwise, step score is okay. It's not competitive. Specialty. Um, so you can just have your step with like 230. I think it's good enough. That's what my score is. So, um, and then year of graduation within 5 years, 3 years, and then you can get in.
Yeah. So what advice, I mean, obviously a lot of the things that you've answered so far answer this next question, but I want to give you an opportunity to answer it directly as well. But for any student at our medical school right now, let's just say they're in first year, they're in second year, third year, or fourth year, and they're interested in family medicine, are there any specific advice in addition to all the insightful pointers you've already mentioned so far that you would give to them for them to keep in mind?
Just keep in mind that if you think about family medicine, you have to think uh, do you like to take care of them as a whole? Like, so you want to do you like to study everything? Is very broad and sometimes very frustrated because it's so much of everything.
Mhm.
So start to focus on those. And then for clinical years, you can try to go into the family medicine core and then try to do elective with it to see if you really truly want family medicine. Because once you go there, sometimes they say, okay, family not for me, because this is too much of the little problem. And if you want to be focused on one thing and you want to know deeply about one thing, then I don't think family medicine will be for you. Uh,
Okay.
so when you do rotation, just focus on those to see if actually you love it. Because if you don't love family medicine, become very horrible rotation or residency for you. But
Correct.
once you love to take care of the person that you want to know them from the beginning all the way into their own, family will be the good one. You get to bond with your patients, get to know what's going on their whole life and what the problem they have. Did they see the specialist? What they are going to do with that kind of problem that he has, and then you coordinate those things that the patient has to make, just to make sure that they have all of the screening done, preventative care get to be done because you want to protect them not to get uh, the problem later on. So
Hmm.
you need to focus on that. And if you like those ideas, then I think family medicine will be the one for you.
Yeah, yeah, you really have to be a very sociable person, or at least enjoy speaking with people, and you're being patient and empathetic, like you said. Uh,
Actually, that's right, because I'm the person like to talk.
oh yeah, okay. I mean, it works out. This
I
is the
think
perfect
so. I think
specialty.
I just like talk, and then so
Yeah,
I think Yeah, I want to socialize with people. I want to talk to
Hmm.
patients too. I think that's why family medicine is one of my choice, just because
Yeah.
I spend more time with them and I talk.
That's very good. That's very good because I think in my even in my family medicine rotation, I would even tell my preceptor like, why did we just spend 20 minutes just talking about this person's daughter? And he's like, and she's like, well, first of all, I have a genuine relationship with my patients. That's first. That's the first reason. I really care, and they care about me, and that establishes the trust. And
Mm,
second of all, she said, even in these like mundane conversations, a lot of information comes out that helps you
yeah.
care for the patient. So a
Mm,
lot of times, if to me, like as a medical student, it might seem to me that, oh, this is just like unimportant conversations. But for
that's
you as a
right.
resident, like you're actually in the field, you know that, you know what, even in these small conversations, a lot of information comes out that'll influence how you care for the patient.
Yes, that's true. That's very important because you will see one patient. I don't. You treat them and then they never get better, and then you ask them, surprised at why they didn't get better, and they find out that they cannot compliance with the medications because they change in job and they don't have the insurance, so they stop that medication and waiting for stuff like that, and then they don't have transportation because the daughter like they don't have family member to take them, and they stop going to see the doctors because of that, just something like that. When you dig into it, and you will see why their health is not getting better, why they're not
Hmm.
compliant, and then you can develop a plan for them. Okay, now I understand you why. And then here, if you cannot go to see the specialist this far, maybe just start with this kind of specialist first, and then uh, we can try to manage it first. And if it doesn't get better, then you can decide to go to the specialist later. But you just help them just based on their situation. But you don't know them until you talk to them, and then they open up more, and you understand why
Correct.
they have those kind of problems. uh,
Correct.
you will feel really good about yourself that figured out, oh, the patient has problem like that. Okay, next time you don't have to come here. Like some of the patient, it's really hard for them to move in and out, so it's kind of hard to get like in person checkup, stuff like that. Just offer them a telehealth with those kind of mild problem, and then help them to keep up with uh,
Hmm.
their follow-up appointments, stuff like that. um, the only way
Correct.
that you understand them is the way that you spend time to talk to them. But I know that as the patient go, you only have 20 minutes per patient. So you don't have that much time. But once you have time, just
Yeah.
understand a little bit, and you will feel good, really good that you can help them a little bit.
Yeah. Yeah. That's very true. Okay, so now we're gonna start wrapping up, and I have three last small questions, and these are your final thoughts, right? So the first question I want to ask you is, what would you attribute, um, uh, what factor do you think helped you the most in your journey so far? So, and that could be anything. So for me, I would say, for example, like Anki flashcards. I know you're not the strongest proponent of that, but I say Anki for me and like mental resilience. I'd say those two factors. Obviously there's a lot of other factors that goes into it, family support, et cetera, et cetera. But I would say like mental resilience, having like, an internal locus of control for me was possibly one of the most important factors until now. But for you, as a medical student, what was the most important factor to help you get through it, all the ups and downs? And did that change once you became a resident right now?
I would say it. I think because I have family, the most important is my kids. I want to prove them that
Yeah.
follow your dreams. If you have a dreams, don't give up. And
Hmm.
because of that goal, I think even if we have several hardship during clinical years or clinical years, we will have to show them we cannot give up. It's for
Hmm.
your dreams. Just go for it. You fail, you stand up and you go.
Okay, okay, that's very true. And that's a very strong motivator, when you have something to prove to people that you love. So
Yes.
that's very true. Okay, so now the second question now is looking back, what was the the biggest difficulty you faced in preclinical years, in clinical years, and in residency. If you say one thing in each of those stages, what was the biggest difficulty you faced?
Preclinical will be passing steps one and exam one for sure.
Okay.
That's very sure. Second year is the second year was the one that during last month of clinical, and you have to prepare for interview and applications, and you have to take steps. And I would think that's the most stressful times ever. You have to do rotation. You have to apply for which program you want, prepare for your interview application,
Hmm.
and then taking steps, stuff like that. During that time, I feel really hard for the clinical years. Then residency is the hours when you work, and then you have to study so much, and then you become like a physician already. Now you're not medical student anymore. Everyone, you will have to decide on your patients, like giving like math. Sometimes like, I don't know what I'm doing. That's very hard. Like you feel like the patient life is on you. And
Yeah,
even though you have attendings and residents around, but you cannot ask them every little thing.
of
Sometimes you just
course.
like the nurse call you, hey, what do you want? Stuff like that, and you have to know ahead. And if you don't know, then you have to search a little bit and then call you back. And with that
Yeah,
long hours that you work and you have to learn how to treat the patients, I think uh, that's the most difficulty in residency because of hours of work. Even though family medicine is very chill and work-life balance, but you have those months that you work really long
of
time,
course. Of
and
course.
that's frustrating, very, very burned out.
Yeah. Yeah, the ease with family medicine is only relative. Like it's not looking objectively, family medicine is a very chill. It's very chill, but only relative to like some of the other ones. But average, like relative
Yes.
to like the average job, the
Mm,
average, it's very difficult. It's a
it's
huge
still
burden,
very difficult. Yeah,
of
they have
course.
Saturday, Sunday off. Is still resident. We don't have it much,
Yeah.
even with family medicine. So.
Yeah. And the last question now, any final words of encouragement for students going through this process, IUHS students, but more specifically, maybe even students that are like yourself, who at the time of being students, they had a family relying on them. Any final words of encouragement that would give them that you would have wished someone gave you when you were in that position?
I will say one thing at a time. Uh, Go get your dream.
Hmm.
Just, I know that it's very hard during med school. You don't know if you pass or fail, how you're going to study, how you are going to graduate. You will have those moments. But just take one thing at a time. Whatever you're doing, just do it right and keep moving forward. Don't stop. Do not give up on anything. Just
Hmm.
show your loved one that you can do it and make a model for them to follow. And then you will just think of the brightness after residency. Uh, just give you more motivation. Think
Yeah.
about it, and yeah, just keep fighting and don't give up. That's all.
Amazing. Thank you so much for your words of encouragement. Thank you so much as well for making time for us.
Yeah,
If anyone is looking for a spa in a few years, Dr. Schultz is going to offer us IUHS students a special discount and also for Botox.
there you
Uh,
go. 20% off.
we're going to hold you to this. We're going to have a video recording.
Yeah.
Uh, yeah, but perfect. Amazing. Thank you so much for making time. IUHS students, I hope you benefited from this video. Prospective students, I hope you guys benefited. If you have any questions, feel free to just leave them in the comment section below, and we'll see you guys next time.
All right. Good luck, everyone. Keep
All right.
fighting, study hard, don't give up. Bye.
Bye bye.